Welcome back to Scene Caribbean News. It's now time to go in depth. Reports have surfaced in Jamaica of 2 imported cases of the mosquito-borne disease malaria. Should Jamaicans be alarmed of a possible spread at this time? Well, to answer this and more, we're joined by Jamaica's Chief Medical Officer, Dr. Winston Delahaye. Hi, Dr. Delahaye. Welcome to In Depth.
Thank you. Thanks for having me.
No problem. Regarding these 2 imported cases of malaria, where were the persons traveling from?
All right, but if I could just start by saying, so our purpose for providing the information wasn't to create alarm. In fact, it's exactly why we did. Our policies, as we know, you know, so we're sharing with the population what's happening in the area of health. Specifically as it relates to these 2 persons, we had on January 5th what we call a notification, meaning a person seen by a healthcare professional and deemed to possibly, even without confirming, possibly have any one of these notifiable illnesses like malaria, that's a class 1 disease. They must inform the ministry within 24 hours. And so that was the first case from the St. Catherine region on January 5th. We've since verified, confirmed that case as malaria positive. The patient has been hospitalized, and all the usual activity surrounding notification of that nature. We would be interested in all the contacts. We've been into 180 homes in and around the home of the person, interviewed a similar number of persons, taken 31 blood samples. Happy to report that all the samples we took returned negative for malaria, so that's good news. And we repeat this again in another 3 weeks. Additionally, we have started what we call blitz fogging, meaning we fog in a 200-meter radius around the person's home for 3 consecutive nights in a row, for 3 weeks in a row. And in addition, have sent out what we call a case definition and management protocol to all physicians in Jamaica through the network that we have. So that's the one case, which is confirmed, notified and confirmed. The second case is that of, and I must point out, it's imported because the person is a Jamaican national who lived in an African country and returned with the symptoms. The second case is an Indian national who's been here for some time and sought medical attention. The healthcare professional sent off a blood sample, entertained malaria, and the private lab that got that sample thought they saw evidence of, it's a protozoa called, which they thought they saw. We, in verifying, didn't identify the organism, the pathogen. However, what we've done is sent to the laboratory in Montego Bay for that sample, which we'll review. And then in addition, we're taking a sample per night for 3 nights in a row, because there are times where in malaria, depending on the kind, there are 5 different types of malaria-causing organisms. The organism may not be, you may not be able to see it unless a person is having a fever, a period of fever, for a person is febrile. So we'll continue to take those samples to ensure that we are able to verify or not whether this person can be confirmed. So it's a 2 notification, imported. Important to specify imported because Jamaica was first malaria-free and designated so by the WHO in 1961. In 2006, we had an imported case which then led to a small outbreak. We were able to address that by 2009. The WHO requires you to be free of malaria for up to 3 years before you're designated malaria-free. So since 2012, again, we've been malaria-free. We want to keep it that way, and that's why we're approaching this situation so aggressively.
Okay, Dr. Delahaye, well, you mentioned that they're imported and both patients are currently hospitalized. How are they being treated, or how are they being kept, or are they even quarantined then, so as not to create a problem?
Absolutely. So we're also protecting the other patients on the ward. So we would be keeping them on a mosquito net. All of the preventive measures to ensure that there's no opportunity for spread. It's the Anopheles mosquito in this case, the female Anopheles mosquito, who would bite a person who is infected and then bite someone else, and in that way transmit the illness. But it really underscores the point, the efforts we've been going towards reducing the mosquito breeding. And in the case of ZIGV, it's the Aedes aegypti mosquito. In this case, it's the Anopheles. But be that as it may, the point is the less breeding sites we have, the less likely it is that any illness you have will be transmitted from one person to another. So again, we urge the population to make every effort to reduce breeding sites. If you see something with water in it, you turn it over. And gone are the days when you just get dressed and leave your home. We really think now every single Jamaican should ensure that they have their mosquito repellent on because it's very important. It's different times. We did very well in the 1970s, the whole world, and many countries eradicated, in the case of the ZIGV, the Aedes aegypti mosquito, then dropped the ball. The whole world, we stopped, we felt good and stopped. Now the WHO is recommending that we sustain these eradication efforts because it's not a question of if, it's when will be the next wave of something which is transmitted by these mosquitoes. So it's very important that we stay serious and stay on track with these vector control activities.
Okay, Dr. Delahaye, I'm not sure if you are able to share what or which hospitals these patients are currently staying. I'll
be telling you who it is. So, you know, we respect the patient's privacy.
Or even the region then?
Well, we'll give you the parishes. One is in the Montego Bay area, St. James, and St. Catherine.
Okay. All right, but with the school term in Jamaica up and running starting actually today, is the ministry doing any sort of sensitization with the education ministry or teachers or parents regarding malaria?
All right, so a very important, we actually sent out the advisory, so we have that in the media. I've done at least 8 media programs, so we see that as important as part of our education. I omitted to say we took a total of, or may have, of 31 samples of contacts with the first patient, all negative, all returning negative. So that's good news. No reason to think, you know, to be alarmed. It's not the reason we provide the information.
Okay. All right. So for those who may not be aware, because you just mentioned earlier the Aedes aegypti mosquito, which transmits dengue, which is separate from the Anopheles.
Dengue, ZIGV, CHIKV.
Yes.
Separate.
So which is separate from the Anopheles, which transmits malaria. So for those who may not be aware, how exactly is malaria transmitted?
So you are infected. Usually the person infected, the organism then goes to the liver, multiplies in the liver, then comes into the bloodstream. You then present with symptoms. You're bitten by a mosquito, a female Anopheles mosquito, who needs blood for her egg production. And in that process, there's a life cycle within the mosquito of it's a protozoan parasite, the malaria. And 2 common ones would be Plasmodium falciparum and Vivax. Vivax, the one typical of India, for example, and the falciparum, that of African countries. So about 90% of all malaria is found in sub-Saharan Africa. And so you're then bitten by someone, by an Anopheles female mosquito, which then bites someone else, and in so doing transmits the vector, that's the term that we use, the vector for the malaria from one person, between one person and the other.
Okay, what are
the symptoms which I haven't mentioned yet? So this would include headaches, vomiting, nausea, of course the characteristic fever, alternating with chills in these patients. Patients get very ill. You don't have malaria and stay home. You usually need to seek medical attention. And so it's why we have alerted, sensitized, in addition, all our colleagues through sending out again the case definition and, of course, the treatment guidelines, which is always there, done by the WHO.
All right, my last question to you, which is actually on another matter. The Health Minister, Dr. Christopher Tufton, recently noted that a number of Jamaican nurses, they're leaving in droves to seek opportunities abroad. I'm not sure if you're in a position to share with us what are some of the current initiatives being undertaken to address this.
Sure, it's a number of factors. I mean, this has been so for many years. We recognize the fact that our nurses perform well, or there wouldn't be that interest in them. But when you train ex-persons and way before the training is even completed, 50% of those already have a job from an overseas entity, then ultimately you're going to have a problem. We're not in the habit of preventing persons from traveling with their skills. However, there is a cost to the country for training these persons. In terms of bonding persons, it would appear that no matter what the bond is, these countries, usually first world countries, are happy to pay off the bond. And so we're looking at innovative ways of making a difference in this. If it is that we're training our nurses so well so that they can be exported, for lack of a better word, elsewhere, then we need to be looking at training more. One of the limitations as it relates to, these are critical care nurses in particular, intensive care operating theater nurses. One of the limitations would be the number of available bed spaces that we have for that practical component. And so we're looking at innovative ways of training up a number of our nurses overseas. We may even look at doing the theory aspect here, then having them complete a practical component. We're looking specifically at 4 countries. The already existing relationship with Cuba, and they are the nurses that we've been using to fill the gap. And in fact, we anticipate the arrival of over 40 to 50 of these from this particular group, critical care group, nurses from Cuba in the next couple of weeks. But we must look forward at being able to expand our training, and so we're also looking at collaborations with the United Kingdom, China, and Canada. And so the thought is that in this first phase, we would get a number of nurses trained up to return to then expand our bed space in terms of intensive care beds with these newly trained nurses to then be able to train more, including training for those overseas countries as well. And so it's a win-win situation, takes a little planning, but we've sat down and we're putting pen to paper to look at all of these options.
Okay. All right. Thank you so much, Dr. Delahaye, and be sure to update us on the cases of malaria.
All right.
All right. Thank you. Well, we were just in discussion with Jamaica's Chief Medical Officer, Dr. Winston Delahaye, discussing 2 reported cases of malaria on the island and other matters.